Good morning, everyone. I would like to present my study on the correlation of different grades of visual acuity more than equal to 6/12 with contrast sensitivity and stereopsis in patients with primary open-angle glaucoma and ocular hypertension. Despite their normal or near normal Snellen visual acuity, patients with glaucoma often complain of poor vision. This study was conducted to understand the symptoms better and help in developing vision assessment to monitor patients in the early course of the disease. My objectives of the study were to determine the correlation of different grades of visual acuity more than or equal to 6/12 with contrast sensitivity and stereopsis in patients with primary open-angle glaucoma and ocular hypertension, to compare the contrast sensitivity among POAG and ocular hypertension, to compare stereopsis among POAG and ocular hypertension. Coming to my methodology, it was a study design. It was a hospital-based cross-sectional study done at the glaucoma clinic of Tertiary Care Eye Hospital in South Kerala, and the study period was 1 year. These were my inclusion and exclusion criteria. The sample size was calculated based upon the study by Stephanie Lin et al., and it came to be 109. The study variables were socio-demographic variables, visual acuity, visual field index, mean deviation, monocular contrast sensitivity, and stereopsis. After getting an informed consent from patients who fulfill the inclusion criteria, a detailed ophthalmological examination was done. Corrected distance visual acuity with Snellen's chart at 6 meters was done and converted to logMAR value. Slit lamp biomicroscopy was done with a plus 90D lens and gonioscopy was done. Visual field of the eye was analyzed using Humphrey Field Analyzer 24-2 program. Monocular contrast sensitivity was measured by Pelly-Robson contrast sensitivity chart at 1 meter. Binocular stereopsis testing was done by Titmus test at 40 centimeter. Coming to my results, majority of my patients, 64.2% were having primary open-angle glaucoma and 35.8% were having ocular hypertension. Majority of my patients came under the age group between 51 to 60. Majority of my POAG patients were females and majority of my ocular hypertensive patients were males. Distribution of visual acuity in logMAR units. Majority of my POAG patient had a visual acuity of 0.2 in logMAR units, and ocular hypertensive had a visual acuity of 0 in logMAR units. Distribution of monocular sensitivity, contrast sensitivity. Majority of my POAG and ocular hypertensive patients had a monocular contrast sensitivity in the range of 1.5 to 1.8. Majority of my patients had a stereopsis in the range of 101 to 400 seconds. Correlation of the visual acuity with contrast sensitivity and correlation of visual acuity with stereopsis did not give a significant relationship. MD value correlation with visual acuity in primary open-angle glaucoma gave a non-significant large positive relationship. Visual field index with visual acuity in primary open-angle glaucoma showed a non-significant relationship. In my study, comparison was done using unpaired t-test and comparison of contrast sensitivity among POAG and ocular hypertension and comparison of stereopsis among POAG and ocular hypertension. The difference came to be not statistically significant. However, significant association was found between stereopsis and contrast sensitivity in POAG and between stereopsis and contrast sensitivity in ocular hypertension. That is, those with decreased contrast sensitivity had decreased stereopsis also in both POAG and ocular hypertension. Coming to my discussion, my study consisted of 109 patients with 70 POAG and 39 ocular hypertensives. In my study, visual acuity more than or equal to 6/12 did not show a significant correlation with contrast sensitivity and stereopsis. In a study by Amal et al., stereo acuity significantly decreased in early glaucoma, and in a study by Hawkins et al., reduced contrast sensitivity was found to be significantly correlated with good visual acuity, and compared with visual acuity, the disease process preferentially affects contrast sensitivity. In my study, 25.7% of patients with POAG had a contrast sensitivity of less than 1.3 units and 28.2% of ocular hypertensives had a contrast sensitivity less than 1.3 units. 5.7% of POAG patients had stereopsis less than 40 seconds and no ocular hypertensive had a value less than 40 seconds. In my study, there was a significant association between contrast sensitivity and stereopsis. That is, patients with decreased contrast sensitivity also had a decrease in stereopsis in both POEG and ocular hypertension. This was similar to other studies done by Stephanie et al., who said that the vision in glaucoma is a multidimensional construct and the contrast sensitivity and stereo acuity correlated with each other. Study by Jess Richman et al. Showed that the aspects of visual acuity that predict ability of a patient with glaucoma to perform activities of daily living are visual acuity and contrast sensitivity. To conclude, in my study, there was a significant association between contrast sensitivity and stereopsis in both POEG and ocular hypertension in those having good visual acuity. However, correlation of visual acuity more than 612 with contrast sensitivity and stereopsis was not found to be significant. This can be attributed to the fact that my sample size was small, study was clinic-based, and the study subjects need not have been a representative sample of the population. Hence, I would like to conclude that the vision assessment in glaucoma should be not only based upon visual acuity, but also based upon contrast sensitivity and stereopsis. These are my references. Thank you.
So you have selected the sample size, or the statistician have done?
Statistician have done, sir.
You know how to calculate and all?
I asked a statistician, sir. He told me how to calculate based upon that value. Based upon the formula.
You are told now contrast sensitivity as well as stereopsis are reduced in POEG as well as ocular hypertension. Yes. Significance is there. The treatment was started for ocular hypertension cases or not?
It was not started, sir. For
not
POEG
started.
Patients,
it was started.
What about ocular hypertensive patients were on just lubricant drops only. They were on
ocular hypertension study report you studied.
Yes, sir.
You have not done as per ocular hypertension study report. Did you start or not?
No, sir.
The treatment
was not started. Visual field effect was not there.
No. Ocular hypertension study report says better to start the treatment if
yes,
you have got a value of 24 and above.
Yes, sir.
We were intraocular hypertension means you have mentioned which IOP you have taken as ocular hypertension.
Range, sir.
More
than 21, sir.
21. Sir. Anyone about 24, 25 and all?
Up to 25 I had taken, sir. My sample size patients are that. Up to 26.
So 26 means you would have started treatment then.
No, visual field progression was checked.
No. This is a study report. You have studied or not? Ocular hypertension study report.
No, sir.
You have not heard?
No.
Better read that also, no? Okay.
How do you account for that decrease in contrast sensitivity in ocular hypertension?
Even in ocular
and what is the relevance of finding this decrease?
Even in ocular hypertension, madam, the optic nerve fibers are getting damaged, and this may not correspond to visual acuity, but in contrast sensitivity we can pick up it early. That is, optic nerve damage is occurring. We can.
So you start treatment once you find decreased contrast sensitivity in patients.
We have to start treatment ideally, but we need a larger study, and we need to analyze more number of patients also.
Why waiting for larger study, man? See, already problem is there. Why do you start that? Why can't you start the treatment? Otherwise, at least you can do.
You have heard about ocular hypertension treatment study, no?
Yes, madam.
Yes.
She has not studied that.
Not studied.
You just study all the glaucoma study reports.
Okay.
So all the glaucoma study reports, all the optic neuritis treatment trial, everything, diabetic study reports. For a PG, it's a must.
Any patients had cataract in the study?
Patients with significant cataract were excluded in my study, madam.
Were excluded.
Excluded.
Okay, thank you.
Thank you, ma'am.